Coming to our topic of interest today, endometriosis. It affects 1 in 10 women. Almost 200 million women are suffering worldwide. There is an average delay of diagnosis for 7 to 10 years. Handful of endometriosis excision surgeons are available to deal with it properly. Now, when we say there is lack of awareness on endometriosis, we always say that if it had been a men's disease, there would have been proactively some work going on. Being a women's disease, for generations together, women are told pain is normal, you get married, have children, your pain will go away. So, this myth has taken a great place in our societies and the families altogether. It is becoming very difficult for us to bring them out of this scenario where they have to accept and come forward and talk about the period pain so that they can be diagnosed early. Most of these women are coming when they are trying for pregnancy. Now, with awareness, many women are coming with pain when they are not trying for pregnancy, also, but a lot needs to be done to bring more awareness for this. Now, endometriosis is a condition where the lining similar to the tissue of the uterus. Please mind the word similar tissue. It is not the endometrium lying outside. It is a similar tissue to the endometrium which gets implanted or it has ectopic sites. It can be anywhere in the body other than the uterus. If it is in the uterus, we call this adenomyosis. And if it is outside the uterus, it can be fallopian tubes, ovaries, peritoneum, bowel, ureter, liver, diaphragm, anywhere in the body. That is called as endometriosis. The origin of endometriosis for years together because of Sampson's theory is believed that the reflex menstruation causes that. We as endometriosis specialists don't believe in that theory. This basically is explained by Dr. David Redwine. That theory of mulariosis explains the existence of this disease. A retrograde menstruation can never explain how endometriosis happens in a fingertip, which has also been reported. So there are uncommon sites which can never be explained by retrograde menstruation. So theory of mulariosis and a mix of genetics and epigenetics plays a vital role in the causation of endometriosis. Why endometriosis care is delayed? What are the major hurdles? One is lack of standard of care. Some people believe in medical therapy. Some do not want to operate. In our society, especially young girls, unmarried girls, nobody wants to operate, and the families also don't want to get operated on them. So that there is a lack of standard of care. A lot of gaslighting by medical fraternity and peers. Half of my patients, more than half of my patients, come and tell me that the previous doctors told them pain is normal, get married, have a child, you'll be fine. So it's all in your head. All these things make them more vulnerable and they go through a lot of mental trauma because of this. Lack of familial support, delay in diagnosis. In medical school, endometriosis is still not a subspecialty, and the excision specialists are lacking. There has to be more training and more teaching how endometriosis excision is done so that more and more surgeons can do these surgeries on women suffering with endometriosis. The barriers to endometriosis care, the international organizations, gynecology organizations, excision surgeons and the facilities, and medical school teaching. These are the contributory factors which are delaying the standard of care and diagnosis as well. There are certain patient-centered factors as well, such as embarrassment. They don't want to talk about it. Tolerance, they keep tolerating it because their mother tolerated it, their grandmother tolerated it. So, and there is a stigma attached to periods. They don't want to talk about it. And there is an uncertainty of normal versus abnormal symptoms. They don't know because there are a lot of myths surrounding periods are doing the rounds. Physician causes, it's still not a subspecialty. We try to normalize the symptoms. symptoms. Many of our patients come and tell us that they have been told by several doctors they consulted earlier that painful periods are normal because their reports were normal. Now, negative imaging does not rule out endometriosis. Please keep that in mind. Misdiagnosis, gaslighting, reliance on inadequate diagnostic tests. There is no foolproof blood test or diagnostic test for endometriosis. Sorry. CA125 can be slightly raised, but that does not rule out or diagnose endometriosis if it is raised. Reluctance to advise surgery on the part of doctors. As I told you, they don't want to operate if a girl is unmarried or she's younger age group. We aim to improve the quality of life of the patient. So we have to look how her quality of life will be affected with our decisions. Heavily dependent on medical therapy. Medical therapy in endometriosis does not work. The patient's symptoms may subside if they are given some hormonal therapy like oral contraceptive pills, progesterone therapy, or GnRH analogs, but the progression of the disease does not stop. So, a complete information should be given to the patient before. Sometimes I agree, patients do insist that they don't want surgery and they want to try medical therapy, but it's our duty to tell them that the medical therapy has its own side effects. The disease progression cannot be stopped. You may have more chances of infertility and reproductive organ damage if we continue on the medical therapy without removing the disease. And above all, clinical guidelines do not provide consistent approach. The size of endometrioma, if we take for an example, which side should be operated, which side should not be operated, there are no clear cut guidelines. It's a case based management which we do. As I mentioned, misdiagnosis is very common. 2/3 of women are misdiagnosed, and half of them have already met 5 to 6 doctors before coming to endometriosis specialist. They are misdiagnosed as IBS, that is the most common misdiagnosis. Period point, they are told it is normal, PCOS, thyroid issues, depression, and they're also told that you are imagining, overactive imagination is playing a role. Patients sometimes describe taking a grand tour of a specialist before coming to us. They have gone to gynecologist refers them to gastro doctor because they have diarrhea, constipation, but no other symptoms related to gynec this thing. Endometriosis can have varied presentation. You may not have always typical features of painful periods. You may have a variety of symptoms. They may have fatigue, they may have only fatigue. And fatigue is not something feeling tired at the end of the day. Fatigue is after sleeping nicely also you feel tired. Depression, pain, infertility, mood changes, fear, joint pains, IBS, diarrhea, constipation, neurological symptoms, radiating pain. So all these symptoms they can present, and they may not have all the symptoms. They may have some of these. So that is how it misleads. But we have to be endometriosis minded to diagnose endometriosis. As I was mentioning, gaslighting, it is a very, very prevalent phenomena. Basically, it is to manipulate someone by psychological means into doubting their own sanity. If a patient is told, you are so sensitive, why are you so defensive? Stop acting crazy, it's all in your head, you are making it up, you are so thin skinned, your tolerance is very low, you're pathetic. So, these are all gaslighting things which is being practiced, and patients do come to us and tell us.